There's no long-term effects of birth control, correct?
There is I will say this again to everyone. There are no long-term effects of birth control.
Even if you've been on it for 20 years?
No long-term effects. It literally has not been proven to increase in fertility. In fact, in some birth control pills, it may, once you're off, ramp up your fertility for several months because your ovaries are trying to ovulate. Once we take you off of birth control, they're like ready to go.
Oh.
But with IUDs, we've never prevented ovulation from the very beginning. Yay!
Welcome back to Straight Candid Podcast
with Sid
and Soph, where we take pride in normalizing taboo conversations, saying the wrong thing, drinking too much caffeine, and talking too fast.
Here at Straight Candid, we live unfiltered. No edits, deletes, or drag and drops. Just two Minneapolis girls who hit record and keep it candid.
Let's get into it.
Let's talk about vagine, baby.
Let's talk about
you.
Pap smears. And douching is bad for you.
And tampons are not good to sleep with. Let's talk about
periods, orgasm gap.
Let's talk about men a little bit.
A little premature ejaculation.
And that's why we do podcasts and we don't write music or sing.
Oh my gosh.
Thank you. Thanks for coming.
I sing thanks very much.
Oh yeah, you're good at singing. She was like, yeah, I was in a play. I'm like, yeah, I'm not surprised.
I was in musical theater.
She wasn't. She's theatrical.
So theatrical.
I'm not gonna lie, I was the little red hen, second grade. Don't forget
little
it.
redhead?
Little red hen.
Oh.
I was a little redhead. I was also the muskrat in the mitten.
Oh, cutie.
I was at my school. Anyway, what's going on?
I was the mayor of Munchkin City in the county of the land of Oz. I welcome you most legally.
I don't really like plays.
Fuck you.
Just kidding. I'm totally kidding. That was really good though.
That was the only line.
I have a cut right
that
there.
was the only line I had in Wizard of Oz when I was the mayor.
Wait, that was the only thing?
I was the mayor of the Munchkin Land.
The Munchkin Land?
I was like really young. Okay, moving on.
Anyway.
Yes, we are talking about vaginas and
kill me.
Vaginas.
Yes.
We're having Dr. Sarah back on the podcast.
We're talking about the orgasm gap. We're talking about men and women. We're talking about sexual discomfort.
Mm-hmm. My favorite part, SSRIs, or how anxiety antidepressant medications affect sex. So we're going to get into all this very, very soon.
All the details.
OBGYN Dr. Sarah, who works at Oakdale, is going to be coming on the pod very soon. But
she's the most amazing human ever.
Obviously, straight candid moments. Yeah. You go first because I can't even think of mine right now.
Number one, I got my booster shot. So if you haven't, go get it. Oh, it's a fun time.
Get that boost. I got my Gardasil booster.
Wait. Oh, hey.
We'll talk about that later on the episode too.
Okay, a few things. I was on the plane coming back from New York.
Mm-hmm.
Actually, I should back it up to tell the story. I go to the airport from New York. I'm a little distraught. I'm slightly hungover, 100% dehydrated. And I get to the airport and I'm just checking my bag. I'm like, okay, I'm already cutting it really close. I just got to find my mask in here. Digging around. I'm like, oh, that's Emily's keys to her apartment.
Oh no.
And I'm in New Jersey right now at the airport and she only has one pair of keys. And I was like, oh.
Why did you have her keys in your purse?
Because I went to go get a coffee before because I was dehydrated and hungover. And I was like, shit, you idiot. So I literally go up to this guy and I basically had to like sweet talk him into holding them. And I'm like, please hold them. And he's like, I can't do that. You got to go find this person. I go, well, where are they? And he's like, I have no idea. And I'm like, please just help me. Like, and I had to call them and I'd be like, you're going to have to Uber to the airport and I'm going to have to pay for it. So,
$500 later.
No, literally. And I had to pay for her to come get freaking the keys.
Wow.
And then anyway, I get through security. Long story short, I get on the plane. It was delayed. So I was running for no reason and panting. And I'm like, they closed the doors. And I'm like, you closed the doors? And I like yelled it. And they're like, we're delayed an hour. And I'm like, oh, I'm just going to go sit down because I've been, doing too much.
What a bitch. Wow.
I get on the plane. The girl next to me was like, hi. And I was like, hello. And I just sat there and like turned my head.
How did she say hi?
Hi. And I was like, hello. And I just kind of like moved over and she kind of like,
wait, are you a plane talker?
No.
Okay. Are you a plane talker? Do you not like to talk?
I'm hungover. Yeah. Usually I do if it's like an earlier ish flight or an afternoon flight. But once I put my headphones in, please.
I don't like to talk to people. I'm like, it's my time to relax. So like, I'm always nice to say hello, but then I make sure I'm like earphones in Sorry.
This is going to sound weird, but if they look like they could be a mentor to me, like if they're in like a suit, like or woman's suit,
If
I'm
they
like,
look rich, I'm going to chat up those
no, I'm
bitches.
just I'm like, so what do you do for work? Like, I'm just so curious about people's freaking whatever. Anyway, this girl sitting next to me, she's being super like in my bubble. Like I was like, I'm going to get up and go to the bathroom. And she followed me to the bathroom and went at the same time, which actually is courteous of her. But she kind of like stood there and smiled and kept like,
I'm
kind of like
picturing that
looking
one
around.
girl from high school that everyone's thinking of right now.
It's just like, it was just kind of odd behavior. Anyway, so we go and sit down and I'm prepping for the episode and she's reading my notes the entire time. And so you know what I did?
You wrote stop looking at my
I literally just
page.
kept writing out like as crazy as I could think for this episode. So it was like, vaginas, and I was like, why does my discharge like I was just trying to fuck with her because she was reading she's literally looking at my laptop like this. Like who does that's weird. Like look away. But I kept being like penis, and then I'd write penis. It's fun. Okay, if someone's creeping on you, it's kind of fun to fuck with them. Like I might as well fuck with them. Yeah. So anyway, I felt like such a dweeble, but she was creeping on my text. So
I'd feel really cool. Like I have a fun job. I get to write about penises.
Yeah. So anyway, I don't know. That's my weekend. I did get my first laser hair removal today, by the way.
Wait,
down on my under, on the land down under.
Did you?
Yes.
What you did a lot today. You didn't work today, did you?
Well, technically, if my boss is listening, I did work today.
You literally did so much.
I know. I'm tired.
Okay. I've heard that laser hair removal hurts more than getting it waxed, which is why I'm scared, because when I got it waxed, my waxing story is just not good. I just started sweating. I had to stop.
Everybody does that though.
Yeah, but I had her stop in the middle.
Really?
I was half naked mole rat, half full bush.
You're like, that's enough. That's enough.
I said, that's enough. I'm never doing this again.
You're
But
like
anyway,
a little spotty.
How bad did it hurt?
So this was my first time. Apparently, yeah. I have dark hair.
Do you have to grow it out before you do it?
No, you shave it.
Oh,
it's opposite.
Okay.
Which is weird.
Maybe I'd get into that because I hate the fact you have to have a bush for waxing.
Yeah, no, you shave it, and it's kind of nice that you don't have to have it on. Let's see. I have tattoos. It was worse than that. Does that give you it's worse? Yes, it's worse than a wax, but I will have to do it about 10 to 12 times in my entire lifetime versus waxing forever for the rest of my life.
I do feel like you're going to benefit from this.
I'm going to, because
you'd always get ingrown hairs and
it's uncomfortable.
It's not fun.
But I will say I had to be like, okay, please. Because they give you blackout goggles and you're literally on the table, like spread eagle, and there's a laser and it's like,
how long did it take?
It is electrocuting the hair.
How long did it take?
Literally maybe 10 minutes, less than that.
Oh, and you only have to do it how many times?
Like 12 times. Like in your lifetime. No, but it gets less and less. So by the time I get to like 5, it's going to be like 10 hairs.
Maybe I'll.
But I will say, first time, you don't know what to expect, but it's scary when your legs are open and there's goodies hanging out and you're like,
hi.
Yeah. And she's zapping you and you're like, that's very close to the, whoa. You're like, oh my God.
That's close to my
what if you
labia
don't get that part?
minora.
I'm like, whoa. So perfect timing for this episode.
Oh my gosh. Yeah, we should have told
I'm
Sarah
sweating.
about that.
I'm already sweating
she'll
thinking about it.
And she'll know.
Yeah. Anyway,
oh
okay,
my
sorry.
gosh. I didn't get a wax today. Didn't get the nipple pierced today. Let's think here.
Piercing and workout.
What?
Pierce and lift. That's what I called it.
Yeah.
In the description.
Yeah. I think my piercing is a little infected though. I'm not going to lie. So
you need to look into that.
I know.
Seriously.
Well, I think it's just a little sore,
Well, figure that out.
Yeah, I will.
Okay.
My circadian moment, I don't really have like the best one.
You don't need to have a good one.
I know.
I mean,
I went out again this weekend. I don't know what's been going on, but I've just been enjoying like going to the bars lately.
What? Well, that's not a bad thing.
No, I also had a cute outfit. And it's like, okay, you want to wear a cute outfit out?
Hell yeah.
And I went with some friends, met up with Jerdy at Cuzzy's after. The funny thing is I like pretended I called a Lyft. Jerdy and his friends were like, did you get a Lyft home? I'm like, yeah. Like, I'll see you guys later. And I decide I'm going to walk home from Cuzzy's. And it was snowing and I was wearing heels.
Excuse me?
Did I tell you this yet?
No.
Yeah, no. So I was like, so I started walking. I'm FaceTiming literally everyone in my phone. Like FaceTime. Like it was so fun. I was having a great time. But then I get halfway and I'm like, it's really cold out. So I found this random apartment to go into. And there was like a doorman and the outside, like even the entryway, between the two doors was locked. But I was like waving at him and he let me in and he let me sit on the bench and he's like, would you like any water?
Oh, nice.
And I called my Lyft from there. I spent $40 from Fairgrounds to my... Oh,
What?
shit. I just said where I lived. Whatever.
No. Wait, I'm sorry.
Fine.
You can bleep it out.
Yeah.
That's like 6 blocks. Wait. Wait. You spent $40?
Did I get ripped off? Let me look.
Honey, that's really bad.
But it was also 3 a.m.
Okay. So, but that seems weird because usually it would be the surcharge that would be high.
Gosh. The other funny thing is that when I was at, I almost said the Loop. When I was at the Loop, which is obviously my favorite bar, y'all know that.
Want to go there this weekend?
What?
Want to go there this weekend?
No, I'm not drinking this weekend.
Oh, okay. Perfect.
I'm taking a weekend off because I have to drink the following weekend. I'm taking a weekend off. I'm saying it out loud now. Maybe I'll go. Maybe I'll go.
Maybe I'll just go. Night.
Oh no!
Friends supporting friends.
Gosh. But I was at the Loop and so many people were like, there were so many Straight Candid listeners there. So it was really fun. It was really cute.
We do go there. We frequent there often. Actually, I've been going out more often. But I was just gone this weekend. But
I need to stop hyping it up because the lines are like at 8 p.m., like 2 hours long. So no thanks.
Perfect.
Yeah. But y'all don't even know what the Loop is if you're not from Minneapolis. So we're going to move on. That was a fun little Straight Candid moment.
We love that.
Yeah.
No, we love it.
Let's quick talk about Best Christmas Ever.
Best Christmas Ever. It's coming up. So we're partnering with the Back Pocket Podcast. You likely heard it at the last. Why did I just take such a deep breath? We heard it in the last episode, but we are sponsoring a family for Christmas and we are raising money and we bumped our goal from 20 grand to buying somebody a house. And so this family is living in a hotel currently. There's 6 of them. They're a family with 4 kids. All 4 kids have a special need. And they need a permanent home and it just cannot go any longer living in a hotel.
We need you. If you're listening right now, instead of subscribing, rating, reviewing, please go to our link in bio, scroll down. It's all the way at the bottom. Best Christmas Ever. Whatever you can donate, even if it's $5, $10. If all of our listeners were to do that, we would literally be able to do this. So we would meet our goal. We would meet our goal. So if you can take the time, like out of anything you get out of this podcast, we obviously are going to get so much knowledge. We're bringing you this knowledge for you guys. Like we don't have you pay for subscription. Please go donate for Best Christmas Ever.
For the family. Like if we ask one thing for Christmas, please just go donate. We are having an event at Gray's if you're in Minneapolis, 6 p.m. on December 16th. That is a Thursday night. We are going to be hosting an event with the Back Pocket production.
Ugly Christmas sweater.
And I'm telling you, everyone is invited, no matter who you are, no matter what you do.
Everyone is going to be there. So show up. No, it'll be Grace is an awesome little vendor. We have some food there. We'll have some drinks.
We have surprises.
Honestly, it'll be a great time with ugly Christmas sweaters. Why not?
There's going to be, you take us on in beer pong. So
let's go.
Bring your A game and you have an opportunity to ask us questions live and meet us live. So literally meet us, donate, come for a good cause, get some food. That's money's going to go towards the family. Be there, be square, dogs.
Again, December 16th, 6 p.m.
Please.
Grace. Cool.
Grace in
One
Minneapolis.
last thing I want to say about BCE is we're going to have Ron jump on here, who actually started Don? It's Ron.
I think it's Don.
Crap. Dom. We haven't met him yet. So.
Don. D-O-N. Don.
We haven't met him yet.
This person, I can't.
Oh, we haven't met him, but he's going to be talking with the Back Pocket Boys and he's going to do a little intro kind of about his story and the meaning behind Best Christmas Ever. He actually started it.
He started Best Christmas Ever
because someone gave him a gift for a Christmas and he was like, he made a whole organization around this because he remembered that feeling of how important that was.
It changed his life forever. It changed his toll. He was down and out and he got a gift for somebody and now he has a whole entire thing. So now we hear from Don.
Best Christmas Ever. It wasn't something that was, set out to do or anything like that. It came at the effects of getting real sick. I was struggling. Have you ever heard of ulcerative colitis before?
No.
Crohn's? You heard of Crohn's?
Yes, I've heard of Crohn's.
Yes, it's a sister disease to Crohn's. And I ended up having, which it ultimately led to a complete removal of my large intestine. And so I was in my 20s. I was a single dad, a 3-year-old son, and I was down 80 pounds from what I am now. My skin was starting to be yellow and gray. So there I am, Christmas Eve, looking at a empty Christmas tree, and just these thoughts and feelings of how am I going to explain to my son the next morning? He gets up, 3 years old at that age where they get up and they're running, and what am I going to say that, nothing that year. And it felt like I had a giant hole in my chest. If you ever gone through a real tough time, it almost feels like numbness, like you're outside in the cold and it's you can't get warm. And thankfully I didn't have to have that conversation. I ended up getting a knock on the door, and my mom and some other family members had put together 2 bags of gifts. So I go over there, receive them, come back in, and dropping them around the tree. And I was just bawling. I'd received gifts before, but I'd never been in that place before, where somebody else counting on you. And as I put them around the tree where that hole was, it felt like a little fire got started, tingling all throughout my body. And God planted the seed to be able to pay this thing forward. And so there we were. We had so it would have been a year to the date later. Year to the exact day later, had reached out to some friends. Jason had reached out to some family members, some different people, and just like shared about what happened. Let's get this thing rolling. Partnered with Life 97.3 Christian radio station. Said, hey, can you help us find the family? Help us find it. We'll take care of everything else. And so there we were, standing on porch. A family had no clue. This is no nominated. Now we have like the nominator. You have like other people, like things. We were literally drove out to, middle of nowhere, show up at this house in the middle of a snowstorm, but, knock on their door, just start carrying stuff in. And, from doing a drop, you get that where it's like, they're like, what's going on? What is this? But then as you start to go, then the kids start to run around, grab the stuff and go. And, when did that, went back in the car and just literally just like shaking, like the adrenaline was pumping and just like that shaking feeling. And we said, like, wouldn't it be cool if we could double the amount of families we serve? Then we started. 1 went to 2, 2 went to 5, 5 went to 10, 10 went to 25, 25 went to 50, 50 went to 100. And now this year, we're going to bless the most families we've ever blessed before. We're going to bless 170 families. What that equates to in annual giving, about 1.7, 1.8 million that we'll actually be giving directly to families. And it's just the reason why it's just amazing people continue to step up over and over again, as as being a captain. And you see, like, I don't know, are you in the captains group at all on Facebook?
Yes.
Yeah, it's just like I don't know if you saw that post come through where somebody was like, hey, the store is going all out to hook, to set captains up. I'm like, reach out to the guy beforehand. Do you know what you're turning loose here? Do you know how many calls you're going to be getting? Because it's just a bunch of just crazy, like crazy, outrageous, generous group of folks that, turn loose to be able to do it. And the internet's a cool thing where we were on with Australia today, planning out their launch in Australia, So it's like, I don't know. So that's the story there. And, but what Best Christmas Ever is, it's a 501c3 nonprofit based in Minnesota here. And we're currently in 14 states in Canada and hopefully soon Australia. And then what we do is we have a framework where we have volunteer captains step up to be able to provide a best Christmas ever to a family right in their backyard.
Huge thank you to Don for putting that together. I appreciate it. That's amazing. So please go to our link, scroll all the way down, and please donate.
All right. Without further ado, let's get Dr. Sarah on the
Sarah.
podcast.
Come on in.
So excited. This is how about your candid moment is this question you got asked from a patient.
Oh my gosh. Okay. Ready?
Okay.
Yeah.
Okay. So I
make sure the microphone's real close.
I know. I'll just do a little. I'll just go like this if it's getting too far away.
Okay.
Because then I can gauge like in our headphones.
So I have a sleep mattress. You're talking about a sleep mattress.
Yes.
You have one, and of course, fancy, right? Like I have the limo of sleep mattresses.
Oh,
so
yeah.
when I first got it, I was like, oh my God, there's so many controls and settings and so forth. But it was our second sleep mattress. But a patient of mine, kind of in the same few days following getting this mattress, weirdly, how coincidental, she was like, hey, I just have a question about whether sex is even possible on a sleep mattress, because do you have to put it on a certain setting? Like, does it have to be super hard, like 80, or is it safe for you to have sex at 30? Because you're sinking in the bed. And I was like,
safe.
Yeah. And I was like, that's the weirdest thing. I just bought a sleep mattress. And then I thought, do I answer it based on what I prefer or what she?
Yeah,
so
I just
said, you know what, you have to just investigate and try out what works for you. And it is a bed that probably is like foam/water, right? It's foam and water. Because anyway, that was my weird moment. I just had my bed. Weird. I just got my bed like a couple months ago, but it was just like that patient
what have
came
you
in.
Found out yourself? What number do you like it at?
I would say it's a personal preference. And your partner probably has a say in that too. Yeah. Dial it up at certain positions, dial it down at certain positions.
Wait, that's awesome.
I mean, I'm just saying you're probably, there's it tilts, it does all these things, but that was my weird Candid moment. And it really was within days of when I got my bed that this patient asked this question.
So
and then
ironic.
I even bounced it back to one of my best friends who's probably listening, or she will listen, and that we were like, hey, do you have a sleep mattress? What's your number? And then we went back and forth, and she's in medicine. So she pulled up.
Is there info on it?
She pulled up
peer-reviewed research.
She literally pulled up this ridiculous piece of graphic that was like ratings of the best sex based on these mattresses. And I'll have to give it to you.
I'm imagining.
It was amazing.
I'm imagining the really soft bed, like trying to like have sex in like a hammock. Like it'd be impossible.
Or like a very low air mattress.
Right, because you would be sinking. Whoa. You know what I mean? Yeah. Like there's certain, like I said, the number is it depends on what you want to do. The number's probably the setting. Depends.
The position.
What are
for
people
sure.
thinking these numbers do? Like you can't go to 10 and like sink into like the bottom of the bed. Like what?
Do they vibrate? Can you set a vibrating setting on
I don't
there?
think mine does.
Well, my first one, the limo of ones, had a vibrating setting. It wasn't like massive,
wasn't crazy.
It was just a little soft thing.
I actually should get that because I like to be rocked to sleep.
This one has a foot warmer. But I'm short, so I have to, I have to shimmy down.
You scoot halfway down. And like, there it is.
Sarah's head's in the middle of the bed.
Just to get my feet warm.
Her husband's like, honey, can you come back up now? She's like way down at the bottom. Also, ma'am, how did you figure out that you would like to be rocked back to sleep? Do you remember when you were -1?
Well, okay. I mean, do you really want to know? So when I fall asleep at night, I like to move my body like back and forth.
You rock yourself.
I like rock myself to sleep, or I move my feet. I like do this with my feet, and
it's called writhing. And I do that.
I rub my feet together. Like I need some movement, and then once I fall asleep, my feet are. But my mom used to drive me in the car when I would try to fall asleep. She used to rock me, and it's literally just how I sleep.
It's called writhing, and both my parents and myself do. Yes, that's what it's called because. Everyone's always like, what are you doing with your feet?
I do it. You do that too.
Yes.
Yeah.
Well, there's no rocking on these beds. So that'll be the next model.
Okay.
It's in like 1 or 2 years.
You're just rolling back and forth like jello.
Oh, what a funny story. Funny straight Candid moment by Sarah.
Right, to kick us off. Sarah, you're back. Yes. Our favorite OBGYN, by the way. I'm switching to you. So just know I'm coming because Soph goes to you now.
Yes.
So when you were on the first time, I was like, I'm going to have to get a new OBGYN because I hadn't really found a new one in Minneapolis. And you guys, I'm not kidding. It was the best visit. Like I've gone there a few times now and you are very educational. Like I've never had someone actually sit down and explain to me the way you've explained different things to me. So highly recommend Dr. Sarah at Oakdale.
I will be coming.
You
I'm
should.
Not kidding.
But we said this, that you have to be comfortable with your provider. And also if your provider is not telling you all the right things, then it's not the right provider, right? So
I honestly don't think I've received like a full like head to toe checkup that I did with you that the first time that I saw you. So and there were things that like have been missed and you really were very detailed. So,
well, thank you.
God, I love that.
Well, and do you know, there are some providers, even though they go to a woman goes to an OBGYN clinic, some providers don't do pelvic exams.
What?
But you're seeing, someone who should be doing it. It just depends on your age and what you're asking for in healthcare. But there are times you should have a pelvic exam. It would be obvious to you that sometimes a certain provider won't do it.
Interesting.
It's really interesting.
I
had a really odd OBGYN. I think I told this story in the first episode, but I went to the U and I just used the like U insurance. So I went to the doctor.
Yeah.
The majority of them that I met were great, but one of them just was like, all right, it's time.
Right.
Take your pants off. I'm like, what? Okay. Like this is very intimate. And my first
was it a dude?
Swabbing. No, it was a girl, but she talked like that.
But she sounded like that.
Yeah. And it was a very embarrassing state because I had very severe periods and it was like not a cute look and I was embarrassed and she was just like, Yeah, I don't know. Like, it was just so like, she was kind of rough and like, all right, that's it. And like flicked her glove off. I'm like, I feel like what's going on? Like, I'm not a science experiment. This is very intimate.
Well, do you know a large proportion of women who get their first exam because they're over 18 and their moms or whoever didn't tell them to go to the right provider? Their first exam is at college with a college provider. Many women. And you know, college providers, many of them come from different levels of training and specialties. Some aren't even, some are, I mean, so it could be variable, your experience.
Yeah. Which it gets scary because then you're not like apt to go again because you're like, I didn't really like that experience. Right. But anyway, I'm coming to you is all I'm saying.
Well, come for sure.
We could not. Yeah, welcome. Like literally both. I'm coming to you and I will come.
Yes.
We are so excited to have you back because episode 39 did so well. And by so well, I mean literally our top episode that we've ever done to date. Ever to date. Like
which
most
is a big deal.
Really big deal. People are listening to it every single week. Like I go and look at the numbers and we see
still
that still crawling.
Yeah.
And we were like, we've got to have you back because we scratched the surface.
Right.
The surface of every topic that we want to talk about.
We have.
And so we thought, okay, what better way to do it this time to do it unisex first, encapsulate everybody, and then we'll go into the vagina specific questions also in the end.
Yeah. And I think like the first episode, we really focused on vaginal health a lot. We had a lot of questions about birth control, soaps like you can put on and how to clean your vagina. So if those are those questions you have, definitely go back, listen to episode 39.
We did lubricants too. So that's a good one to go back to that.
And a lot of like specific questions like tampons, using products, like cleaning.
We did talk about a little bit about orgasms. We'll touch on it again.
Yep.
We talked about squirting for a second on episode 39 too.
And that it's possible and it's a real thing. So perk up, go listen.
But we did not talk about, which is something that is very prevalent in a lot of my friends, a lot of college students, especially because anxiety and depression is just becoming a little more, known and talked about, and people are getting treated more often. Anxiety, depression, SSRIs, being on SSRIs, and how that affects your sex life. Because we talked about this for a second. I think me and Sid tried to talk about this.
Yes.
And I brought up some information from my psychiatrist, but it wasn't.
And an article that you read, I think, too.
It wasn't necessary. I did a whole research paper on it, actually.
That's what it was. An article. It was hers.
In college, because my ex-boyfriend used to have issues with his depression medications and sex. I've had different experiences with my SSRIs. And when I up the dosage, my orgasms aren't as strong. Like they're still there, but some people can't even orgasm at all. So long story short, can we just speak about that?
Yeah.
Let's touch on that.
Antidepressants come in a very global category. They have to be broken down. So the theory of antidepressants, when you say SSRIs, and I'll just elucidate to that stands for selective serotonin reuptake inhibitors. So what these meds are doing is they're preventing serotonin which is a hormone that makes you happy, from being taken out of your nervous system. It keeps serotonin in longer. So that's what an SSRI is. So the categories of certain drugs fall in that SSRI category. So it's been notorious that certain SSRIs do have a more significant effect in decreasing sexual drive and potentially taking much longer to reach orgasm in women, or to even, at all have any initiation in sex. But we kind of have to separate depression and anxiety from the med itself. So the data shows that just to have depression and anxiety, 60 to 70% of people, men and women, have sexual dysfunction just with that diagnosis alone. Because remember, if you're not happy, you're not going to want to have sex. So why even go there? So then when you add the medication then brings up that risk of sexual dysfunction. I'll talk about dysfunction in a second, to almost over 70% on meds to have a sexual issue, right? So sexual dysfunction, that term dysfunction, I hate that term, but it incorporates arousal issues, erection issues, orgasm issues. So it's kind of this lump name, sexual dysfunction, for all those things. So when we break it down to women versus men, women, they do have much more blunted orgasm. They can't orgasm, but it's really where we see a lot of that as lack of initiation, lack of desire. So decreased libido, decreased drive. And if you're not going to initiate and have desire, then you're obviously not going to have orgasm. You're also not going to get wet, right? Yeah. But yes, those who can have a more blunted sensation, and it takes them longer to get there.
Mm-hmm.
So here's my discllaimer. I'm not a urologist. I'm not a male.
Which is a penis doctor.
Yep. I'm male.
We literally Googled before you walked in.
Yes.
I asked the boys, I go, so like, who do you guys go to for your penis doctor?
Yeah.
And they're like, what? We don't go to a penis doctor. And I'm like, well, isn't like a ural? I don't know. And so Jackson Googled, what's a penis doctor called?
There you go. A urologist is a specialist in not only men's anatomy, but in kidney and in bladder. So it's a very global specialty. And family medicine physicians, generalists, can also deal with men's health and erection and dysfunction in having ejaculation. So there are specialists outside of just a urologist who can manage those issues. But when we talk about men, I just glossed over women, but when we talk about men on those drugs, antidepressants, they'll have erectile dysfunction. So they can't get hard. They can have delayed ejaculation. They can have premature ejaculation, but those medications definitely are very impactful. I can tell you there are many other classes of antidepressants. So we said SSRIs, but there's SNRIs, there's NRIs. So there's selective norepinephrine reuptake inhibitors. There's NDRIs, so norepinephrine dopaminergic receptive inhibitors. So if you change the class of the drug and you're having problems, say you identify you're having problems, you see a provider, change the class of the drug, lower the dose, take the medication before sex, because that's something to think about. It's not in your system already.
That's one of the things that So one of the things that I did is I know like you're going to talk about like general, but I think people like to kind of hear little personal stories too. So I'm just going to be vulnerable, but so I lowered my dose for a little bit because I felt good. And I noticed like, like my orgasms felt good again. Like, and then a little bit ago, I upped my dose and I was having issues again, and I can still orgasm, but it just, I noticed it wasn't as strong. It was just a little weaker. Yeah. And I started taking it at night versus in the morning. Yeah. And that seemed to help a little bit.
Right. So
it just helps when it is actually being put into your system, basically, is what it's doing. Right.
Right. So timing of the medication is important, but if you've been on a drug for a really long time and it's helping you with anxiety and the depression, I mean, my God, try not to change the drug, but there are ways to change the class of the drug. So when we think of SSRIs, there's probably 2 SSRIs on the market, and I don't want to advertise them, but there are 2 SSRIs that are not linked to heavy sexual issues. There's, like I said, one of the drugs out there that's been out there for a while is Wellbutrin, is a great drug that is not in an SSRI category that has been used for a long time. So there's ways to
get around it. And do those things.
There is.
Let's say somebody is having like a depression or anxiety problem, male or female, or maybe we can go into 2. Yeah. What would be your best advice for them? Because like for somebody who maybe doesn't want to go on medication or, is choosing to try to get over it for now, but they are having or seeing issues with their sex drive and sex, initiating sex, whatever it is. Biggest advice or next step, what would you say?
Well, I would say just make sure that if you have depression, anxiety, to see if you can address correcting that off of medication. I mean, alternative therapies like acupuncture, exercise, anything that elevates serotonin. I mean, that's the whole point. Serotonin is there, derived from exercise easily, changing your diet, eating cleaner. I mean, those things. But if you're struggling, also it's a partner piece, right? You've been with a partner for a long time. Talk to them about, what can I do? What can you do? Understand me so that they're also in the picture. If you're not with a partner, I think it's important to talk to friends. It's important to talk to people who are in the exact same boat that you are and say, I'm having that same problem. Thank God. Right.
I'll also say, don't be afraid. Like once you've tried, therapy and all this alternative ways before the medication, if you don't decide to knock on the medication because you're afraid of the sex effects, I'll say that because I like, for example, if you are anxious, depressed, your libido's naturally low and you might go on this, you're like, oh, wow, I'm happy again. And your libido might go up. Like I don't have any issues with libido at all. Like I'm still have a very high sex drive, but I was just going to say that don't be afraid to go on it just because you're afraid of the
I would
outcome.
agree. Absolutely. Because I hate the stigma of medication, especially antidepressants and anti-anxiety meds on people. Because if you need it, you need it, right?
Yeah.
Also use therapy, because sometimes therapy alone is the answer to depression and anxiety, and that prevents you from being on a medication. And your therapist can also just pinpoint, maybe it wasn't medication. Maybe, again, deep down rooted before the medication is why you're struggling with, initiating sex or enjoying it or body image issues. I mean, the whole gamut.
Yeah, it's under a huge bubble.
Yeah.
Yeah, it's all of those things for sure.
I have one more thing on SSRIs.
Yeah.
I actually heard this. I forget when I heard this, but I was listening to some podcast and I thought it was interesting. I don't know if we could even talk about it much longer than what I have to say but I heard that guys with ED, there's medications out there, but I've heard that some of them go on SSRIs. Not ED, premature ejaculation. Difference.
Yeah.
Erectile dysfunction is ED.
They go on
right.
on an SSRI
You're exactly
to help
right.
with premature ejaculation.
And we can talk about that. And again,
I haven't heard that.
I'm not a male specialist, but premature ejaculation, and I'm just going to say erectile dysfunction, they're a little bit different entities, but men who have, I'm going to be right. Anyone who has a penis, right? If they have erectile dysfunction, the definition truly is that you can't maintain erection at any time, whether it's with penetration, while you're in your partner and it just doesn't stay hard. But people who have a premature ejaculation, they can ejaculate within a minute of penetration, and they never can hold not having them have ejaculation. They have no control of that. Those two things happen in people with premature ejaculation. But the reason why they're placed on those meds, Soph, is because there's a level of anxiety in those people, and to take them and bring their anxiety down on those medications is what helps the treatment, right? Because if you're constantly worried about, oh my gosh, I'm going to ejaculate well before my partner wants me to, that's anxiety.
Yeah,
and that's why those medicines work.
How would you enjoy it?
That's why those medicines work.
Okay, that makes more sense.
And I also feel like a lot of times, the anxiety associated with premature ejaculation is tremendous, and you could just get in your head, and then it's just going to continue to happen unless you treat the basis of it. But there is also a physiological a physiological reason for premature ejaculation, not only just in your head.
There are some physical causes and some really concerning ones. I mean, there can be a hormone imbalance in men that allows them, prevents them from being erect, prevents them from, having it, holding their ejaculation longer. There are structural problems, people with enlarged prostates, problems with your urethra. I mean, urethra, there we go. It came back again, right? Yeah. So those two structures can create problems with pressure against the penis, and then ejaculation too early. I would say a majority can come from psychological. There can be trauma, right? That is associated with that, but there can be the physical. So anatomical.
Interesting. God, all of this, I didn't know any of this. I mean, that erectile dysfunction is a thing. That premature ejaculation is a thing. It's sad that people talk about oh my God, my partner ejaculates too quickly. Mm-hmm. And there are people out there that likely have these issues and they have no idea that they're having the issues because they've never heard or been educated on them,
So speaking of erectile dysfunction, what about, and we talked about medication, what about alcohol? Because a lot of our
weed.
Yeah. A lot of our age group is, dabbling in the binge drinking stuff.
Yeah.
And
Curiosity.
Hookup culture.
Yeah. No, I think that's probably the most common thing that we all are seeing, right? So alcohol is a depressant. It's also a major inhibitor. So for a hot second, you are very attracted to people when you drink, right? And, so your inhibitions are definitely down, and you think everyone is glossy and gorgeous, right? It's like,
I love hearing this from my doctor because it's so true.
I like the word glossy. Everyone's glossy.
Yeah, they're glossy.
They are glowing. It's like everyone's under a spotlight.
Through your goggle eyes, your beer goggle or drinking eyes. So, but I'm going to just focus women and men, but with women, we know that there needs to be blood flow to the clitoris, to the labia. There actually, I think I touched upon this the last time, where there's actually swelling of those tissues in order to orgasm, and then you need blood flow to get wet. So what happens is alcohol prevents that. It slows it down. So not only are women not orgasming, they're not even hitting climax, but they're dry. So that makes it all for a no, right?
But that's why it's not just like a dehydration. It's like an actual like depressant, slows your blood flow.
Yeah. Here's an interesting
other things.
thing too, is women have a higher body fat than men. So men process liquor faster because they actually have more water. So with women, they can have alcohol sit around longer. They may have blood alcohol levels at higher levels because they have more fat than men inherently.
That makes sense.
So just think about like if you're trying to have an orgasm and being sexually aroused. I mean, it's going to take you a long time.
And the clitoris goes numb and you're like, I give up.
Well, it's interesting because it's like you think that to help with your, maybe like you're anxious about sex or whatever it is, or like initiating, that you should have a glass of wine.
It's a
or
fine,
two or a bottle. Whoops.
And
then all of a sudden, it's a fine
line.
balance.
Sometimes I feel like a glass of wine works.
It's a fine balance. Remember though, the inhibitions are better when you've had a little, but let's
not a lot.
Talk about men, right? So in men, kind of same concept, decreased blood flow to the penis. You need blood flow for an erection. So an erection doesn't happen. So men don't get hard. They don't get hard. And if they get hard, they're going to ejaculate sooner. So premature ejaculation is definitely an issue. There are some crazy terms. Like I have patients who walk in and I'm like, oh, okay, you're pretty honest. I mean, she's like, my husband's limp and what is like
she's like,
whiskey,
you're like,
whiskey dick. Like I seriously had a patient say that to me and I was like, okay.
Yep. You haven't heard that one? Okay.
Right?
All right. So you're in the doctor's office.
I heard a new one the other weekend and now I can't remember what it is. Do you guys have any more? Whiskey dick.
I've heard limp dick.
Jackson, you know any more? Limp dick.
Yeah, we covered it.
I just think they're fun terms.
I mean, I just was like, okay, I've heard that one, but it is true. It just, erections are difficult to keep. Ejaculation happens way too soon. I mean, you can't, partners don't ejaculate. If you want them to ejaculate more frequently than once, if you're thinking more prolonged sex, that's just not going to happen. And there's a fine balance for everyone. You have to kind of know what your balance is. And the other thing I want to put a plug in is if your inhibitions are down, that is not an excuse to have sex without permission, right?
Yeah.
So women, men, both get assaulted. And this is the most common time we see assault is when their complete inhibitions are down and they're having sex. And then everything is seemingly a permissible thing.
Right. Yeah. When you're drinking, basically, because that's when your inhibitions go down.
Yeah. So,
it's just it's a fine line.
Yeah.
And the conversation is being uplifted, but that, it's getting better, but it's not going to be better. You know what I mean?
Right.
Well, speaking of drinking and hooking up and going out and when you want to have fun, you have fun. But STDs are a thing. If you're not using protection, if you are even, sometimes it can happen.
They're huge.
They're a real thing for real human beings. It doesn't just happen if you are sleeping around with 10 people. It can happen if you are having you have a boyfriend and you sleep with someone one time.
Yep.
So
and oral sex too. Yes, anything on the mouth, it can create an oral herpes lesion that is not as concerning as a genital herpes lesion, but that can be on women's labia or on men's penises and they can have ulcers. So, even if it's not penetrative sex, yes.
It can still happen. You can still get it.
Ages. I am seeing right now peak issues in women who are over 40 because one, they think that they're not going to get pregnant. Two, many are not in relationships that are long-term. Three, they don't think they have to protect because it's a 20, 30-year-old issue. It's not.
It doesn't just happen when you're in your college years.
Right.
What STDs should we normalize the conversation about, or what STDs do you see often that people should know the signs of and be able to talk about?
Yeah. Right. And that's why we definitely need to talk about this is because straight candid, this is taboo and no one's going to talk about it. No one admits to having any types of STD, even if it's
your best friend,
even if it's 80% women that have a certain no one admits to it. No one's going to talk about it. So
even
that's
conversations about with your best friends, closest friends, they're not going to reveal that. Yeah. Hardly ever.
It's intimate. And people are afraid because we've not normalized the conversation, right?
So,
well, the most common STDs are still like eons the most common. I mean, I've been in practice now 19 years and 4 years on top of that. So 23 years with my training, but it's still the most common. Gonorrhea, chlamydia, trichomonas. So those three are like the trifecta. Trichomonas. You don't hear it very much, but it is oftentimes associated when someone has gonorrhea or chlamydia or both. They can have all three. So gonorrhea and chlamydia are treatable, but if they go untreated and a woman doesn't recognize it, or a man, but a woman especially, it can create some havoc inside the belly. It can create some scarring, adhesions, pus. It can create tubal occlusion and scarring. It can create infertility.
For gonorrhea and chlamydia, isn't there symptoms for that or not?
The biggest
always?
symptom is really, really prominent discharge, and it's usually very yellow. It can be green. There can be an odor. It can be hot, uncomfortable. Those are the signs and symptoms for any vaginal infection. For men, they'll have clearly obvious, and I don't need to be a specialist in men's health to see this because they've seen it, but they'll have very classic yellow penile discharge, and it'll just emanate off the penile head just out of nowhere.
Oh,
so
yum.
Yeah.
Wow.
Right. So gonorrhea, chlamydia, trichomonas, they're treated by antibiotics. If you recognize it, you come to your provider, you get tested. The tests are really easy. They can be off the urine sample. For men, to be most accurate, it's actually a swab in the penile opening. But but really we want to get, a urine sample or a vaginal swab or a penile swab.
With somebody who doesn't feel quite comfortable, like maybe going to their provider, these guys are cringing over here. Their toes.
And I always look at them when I'm talking about the guy things too. I feel like,
are you guys Googling what it looks like?
Okay, thank God.
Okay,
I'm like, what is this guy doing?
Let us know
over
when
here?
you want to hop on and ask any questions.
Yes.
Right.
With somebody, suggestion for anybody who is not quite comfortable going to their provider and they're seeing these issues, like just freaking go. Should they go online? Just go. Okay.
Just go, because the tests we're doing are very accurate, and it's important to be seen.
But some people, they avoid the doctor at all costs, right? But these are like this could cause infertility. Like you need to go in.
So those are treatable by antibiotics, all three of those. But the other thing that should be noted that's prevalent is genital warts. I'm still seeing a ton of people with genital warts, and the problem with genital warts is
that herpes.
That's different. I'll talk about that too. But genital warts is just big warty lesions. It can be on the labia, it can be on the rectum, it can be everywhere. I've seen a woman fully covered, all over her bottom, extending to the anus. On men, it's very obvious too. It's typically in the top on the glands of the penis, right? So the tip. But there are these lesions that look very fluffy, kind of a cauliflower look. That's what we say. It's that cauliflower look on the surface of skin.
Hope you're not eating right now.
Right. Not cauliflower anyway.
Yeah.
Right.
No veggies for now. Right. This is a veggie-free episode.
So that is still common, and those are treated by either freezing them off or using laser to treat them, depending on how much there are, or medications that are topical. And then the other thing is herpes. Herpes is still very prevalent, and herpes you cannot get rid of. You can't get rid of genital warts either. They come back, they recur, and they're viral. So herpes, I had mentioned, can come from the mouth, oral herpes. So we all have cold sores, but in women who present to me with primary sores on her bottom, it can be from either type 1, which is oral, or type 2, and I have to test for both. And their first outbreaks in women, when there's a whole bunch of ulcers, and in men, the outbreaks are severe. They're painful. They're so tender. There are many lesions. And then down the road, as a woman has dealt with the primary herpes outbreak, or a man, then they can just recur. But they recur less painful, less frequent, less sores, but it's recurrent. And the way to treat those are antiviral medications. Yeah.
Wow. That's
so those are I have the
they are prevalent. They're real things that every person is able to get. It's you don't, just because you're being safe doesn't mean you can't get them.
Right.
With somebody who has an STD like herpes that will never go away, how do you address that with a partner? How do you suggest doing that? Because let's say you want to hook up with somebody at the bar or something like that. Are you able to do that? Or how would you suggest somebody goes about enjoying that.
I think, it takes a while until a person's comfortable, and probably more than just one time to address it. But yeah, a one-time fling probably is not a fair situation for a person who's receiving that from the person who's infected. I always try to tell them you should disclose.
Yeah. I was going to say, if you're a dude and you're afraid to do that and you have herpes, I'm saying this as a female because this has happened to me before. And I actually really appreciated the fact that the other person said something. Yeah. Thank God.
Right.
So he pretty much I had hung out with him a few times. So we were at the bar, we were drinking.
Right.
And we were going to go back to his house. And he was like, I just got to be honest with you, just so you know, I have herpes and it's active right now. And I'm like, oh, wow. And I was like, Lord, thank you. I was like, I literally respect you so much for telling me this.
Yeah.
I was like, that is totally fine. Like, because I appreciate you telling me. And I'll just tell you now, just tell the person, because I literally respected him so much more for at least saying something. Another thing,
if it's, if you're in the situation that you just met this person, it's going to be a one-time thing, put on a condom. It's just the bottom line is it's easy.
But I would not want someone with herpes to wear a condom.
Exactly. Because it can also be like some of these lesions can extend beyond the condom.
Yeah, no.
So genital warts, herpes, it can extend beyond that. So you have to be careful just in contact. The other STD we should talk about is HPV, human papillomavirus, HPV. So we talk about this in women because women are screened with their pap smears for HPV at 30 and above. They're screened every 5 years for pap smear and HPV. And women under 30, they're screened every 3 years for pap only. But what happens in women between 21 and 30 is they're commonly carrying HPV. So when they carry HPV, if we see it in a woman, it depends on how abnormal her pap is, what degree of abnormality her pap is for me to be concerned and to further treat them with something. So if HPV is present, we typically believe that in 21 to 30-year-olds, the HPV will clear. So we're not very aggressive. But in dysplasia, precancer, grade 1, grade 2, grade 3, we treat those women by doing biopsies and surveillance with something called colposcopy, which is a microscope to look at the cervix under higher power magnification. But the importance of checking for HPV is that typically cervical cancer is linked to HPV. So if you have it, you want to clear it. Women 21 to 30 will clear it. Women 30 and above have a little bit more difficulty clearing it because it's less prevalent in them. And, by then it should clear. Your biggest saving grace on that is not only condoms, but getting your Gardasil vaccine.
I was going to say, isn't that the 3 shots that hurt horribly in your arm? That was actually that your doctor's like, it'll be so worth it. And I was literally like, my arm doesn't work. But
it's 3 shots. First shot, then the second in 2 months, the third in 6 months. And now the current vaccine, Gardasil 9, covers for 9 strains of HPV. We know HPV 16 and 18 are the 2 strains that specifically are linked to cervical cancer. It's been studied for years. There's another link of other high-risk HPV strains, some 10 to 15 of them that we can't pull out as specific to cancer, but we know exist, right? But this vaccine extends to 9. Now, men should get that vaccine.
I was just going to say,
it's unisex, isn't it?
It's offered by pediatricians to boys at age 11, just like it is offered to girls at age 11. If a girl is promiscuous or a boy is promiscuous, meaning that they potentially have a chance to be sexually active before age 11, you can offer the vaccine also. But that series prevents men from getting it, men from spreading it, women from getting it and having it as an issue as a cervical cancer risk.
Because men carry it.
And men are carriers, yes. But the question is, do you have to tell your man if you have HPV as a woman, I have HPV? And do men even know they have HPV? No. So when a woman asks me if I have HPV, do I have to disclose that to my male partner? I say no, because likely it will clear.
Yep.
They don't even know that they have it.
They probably gave it to you.
And they don't even know if they gave it to you. And and you can't track that. It's just you've been exposed because you had sex.
What percentage of women have HPV or have what is the stats on this?
In 21 to 30, I would say we see 21, maybe 30% of women. I mean, and it depends on where you are in the world. It can be higher than that.
Which is why you need to get those pap smears every year because you check for that.
And it's interesting.
Every 3 years, 21 to 30 in ages, and then every 5 at 30 and above.
Okay.
Yeah.
But men, they can carry it and nothing happens.
Yeah, because they don't, we don't screen them. We don't screen them.
But nothing happens to them. They can just carry it and it's just like, whatever. Points right at them. Boys.
Is there a way that guys can check to see if they have it?
No.
Oh, wow.
Wow, that's why.
I mean, we could swab them, but it's not relevant because it creates nothing in men. It creates nothing.
That's so
and
stupid.
Remember, genital warts is HPV, but it's not the same strain of HPV that you and I are concerned about with cervical cancer risk. It's a different strain. And so if I give you a Gardasil vaccine, the most important thing about Gardasil vaccine is prevention of cervical cancer strains.
And we got the 3 shots when we were younger, probably,
I did
right?
Get mine when I was young.
I know, I remember it. And I remember my mom made my brother get it too. Like, the boys, if you haven't got it, you should check.
You should at least consider getting it.
I was going to say there's also, I just recently got the first booster shot of it. And you can get boosters for Gardasil now too, right?
You can get another run of 3. Because if previous you had the old version,
get in it.
The old version of Gardasil only had coverage for only 3 strains, 2 or 3 strains, and now this one is extended to 9.
All right. It's just hard for me to think of that right now as my arm is so dead from the booster. Like I'm feeling it right now.
I know. Well, I would space out your COVID booster from this.
Question because so since STDs, all of these, things that we can carry are so prevalent and some are visual or like cause trauma in sexual trauma in people.
Yeah.
What would be your biggest tip for somebody who has maybe like herpes or, HPV or something, if they're having any insecurity or genital warts or whatever it may be.
Right.
And they're having insecurities, because I think that perfectly flows the conversation into the orgasm gap between men and women.
I think it can create physical deformity and image issues. Absolutely. But I think to talk to a provider, because some of these things are treatable. I can make genital warts a little bit better by treating them and making them less visible. Some women who are treated, they sometimes don't even have recurrence of those if they're treated well. People who have herpes ulcers, is just a matter of controlling those. And if they're controlled under antivirals, sometimes they won't even flare. So it just depends. Immunity is a big piece, right? Like anything that keeps your immunity healthy prevents recurrences in these type of viral strains. It's just like COVID, right? Whatever is keeping your immunity healthy, this won't be as bad of a problem.
Yep. Not allowing your stress to get there, whatever it may be.
Before we get to orgasm gap, we do have some men that are listening to the live and have questions.
Oh, sure.
So I think it's just funny because it's coming from men.
Right. No, this is good though. We want
Jackson and Adam are going to read them for us.
Okay. All of them. Oh my gosh.
We'll answer the.
Okay. Oh yeah, good.
Okay.
Hi, Jackson.
Hey, so a couple of these are pretty explicit. They're from the live and group chats.
Not from Jackson or Adam.
Listener
but we
questions.
Want to say them.
I'll just list them off. Is sex on your period safe?
Wait, no. Let her answer.
Oh.
Yes, sex on your period is safe. It's just based on your comfort level. I mean, it's bloody and you're having oral. I mean, that's whatever your preference is. It's absolutely safe. You're not going to get your period. I mean, I'm sorry, you're not going to get pregnant.
And doesn't it? Oh, so when you have sex on your period, you're not going to get pregnant?
You're not going to get pregnant.
What?
And doesn't it slow your flow when a woman gets wet? It slows the blood flow.
I don't know that
down, or maybe that someone told me.
I mean, if you orgasm, what happens is your uterus is kind of contracting. So I theoretically, I guess it may reduce blood flow a little bit for period flow, but it's anecdotal, I think. But here
it was another rumor squash.
Another rumor squash. I was gonna say also. Why are women more horny on their period? So like if it's safe and they feel comfortable, do it.
Yeah, because you're having hormonal fluxes that create your menstrual flow. So there's there's kind of this amazing pattern of estrogen and progesterone that are playing in the ability for you to ovulate and to have your period. So when those hormones are in kind of this flux, women can get horny. Yeah.
I also had no idea that you couldn't get pregnant.
Oh my God.
On your period. We need to note this.
Yes.
I don't know why I didn't know that.
So this is a key piece. When you're on your period, you are shedding menstrual lining and you're not ovulating. ovulation happens when your one egg for women a month is released, and that's mid-cycle. So day 1 of menstrual flow is day 1 of what you're seeing as blood. And most periods last 5 to 7 days, but day 12, 13, 14, 15, from that day 1 of flow is peak time to get pregnant.
Oh, careful.
That's ovulation. So women do natural family planning. They plan around their periods. Some women don't use...
There are apps for that, you guys.
Yes, they don't even use contraception except for their menstrual cycle tracking. Yep.
Holy crap.
There you go. So sorry, there's the...
All right, the next question is, does having coffee before sex really make your orgasm stronger?
I mean, is that coming from a man?
I think it's coming from a man.
You know what?
They're all from men.
I know, I was going to say...
Apparently they've seen it on TikTok.
Okay. Well, I mean, so think about coffee. It's a stimulant. So coffee is a stimulant, and a stimulant can create this surge of energy. I don't know that energy always plays a role in a better orgasm or a better erection. That comes elsewhere, but caffeine is a stimulant. So if it's a stimulant, it's possible.
Wow. Okay.
That's why I'm always horny.
Because you're the coffee queen. You literally are. I'm like the sleepy bean over here.
Yeah.
Coffee queen, sleepy bean.
Oh my God. I love it.
Next one, best sex position to stimulate the vagina.
Well, we talked about this, and this is per preference on how to get there. I mean, so the clitoris and that anatomy from episode 39 I hit, but there is, and people have tried to find it, but it is not something you can dissect out of female anatomy bodies, but there is a G-spot, and there is a position, there is digital stimulation, there's oral stimulation there, but for just penetrative sex, I talked about from behind, like that's clearly where most of that ability to hit the G-spot is to have sex from behind or on the side. It's not all
on the side,
time,
like laying down,
but it's not.
Okay.
I don't know of a lot of people, and this is just from what I know in articles, that it's hit when the female's on the bottom.
I was just gonna say, you can
missionary.
You can tell a male asked that question just because he's saying stimulate the vagina, because
not instead of the right,
and not instead of maybe
the
like
clitoris.
I'm just saying, like,
the clitoris.
Also think of her clitoris. So like maybe she like personally like think of like her going on top, so somewhere where your pelvic bone is up against her clitoris, because the vagina, sure, it feels good, but I think you need to focus on the areas around it too.
And also there is, if you elevate hips, if you are on the bottom, females are on the bottom, and missionary, elevating hips and trying to get to that spot is sometimes how it works when you're on the bottom.
Bring the sleep number right on up. Setting 40, you know what to do.
Just raise that up. Just sit tall.
That?
Yeah,
there we
I
go.
hope that
Sleep
whoever
number.
is asking to understands that like external stimulation is extremely important. And I know we've said it on the last episode.
Yeah.
But it's like, it really is important for majority of women. Like you've told us last time. I'm just like, kind of more so repeating it. But do you want to just quick touch on that? Like just fast before they ask the next question?
A lot of people get orgasm not from penetration. A lot of women, if you talk to them and in the data again, it's not from penetration. So there's a lot before, there's a lot after.
So can we say men should be more maybe comfortable, or your partner should be more comfortable, men and women, with like a toy for a woman to stimulate?
I have had this conversation with many of my patients. If you have a partner that doesn't like you to have a toy with sex, that's the wrong partner.
Thank you. Did everyone hear that? Did everyone hear it?
Because anything to enhance both of you, that works for you, that should be the person. But if your partner's intimidated because you're bringing a vibrator into the room, I think that's a question mark.
It's an insecurity of their own.
Yeah. Also, fun fact, a lot of guys that I've talked to, or my past relationships, past people I've dated, like the feeling of a vibrator in the bedroom on their own self, like vibrates within their body a little bit too. And when I use it, and they're like, oh wait, I kind of liked that.
Oh yeah.
And it was, I was watching you get pleasured. So it's kind of a win-win situation.
Right. No, I
just think a lot of people, like in early relationships, especially, that's why I just wanted to bring it up during that time, is like, you see that where people get insecure about it. So I just wanted to touch on it really quick, because your partners should not feel insecure about it.
Oh, absolutely. So anyway. It should be part of enjoyment of both of you. So not an insecure piece.
Hit it.
Okay.
He's like, dang.
Jackson's like, oh God.
I'm not laughing at that. I'm laughing at this question.
Oh, no.
Okay.
Great.
Okay,
Do girls like it when you stick the tongue in the vagina or just lick the clit?
He wanted me to
A
read
boy
this,
brain. A
and
boy
I was
brain.
like, those are your friends. Those are your friends. You read that.
Listeners.
Well, right. You would say this. It's out of preference. I mean, I think I really can't say that neither are bad. I mean, that it's your preference. But is it going to get, if the question is it going to get a woman to orgasm any sooner? One versus the other? No.
I'm laughing because me and Sid have been sharing a mic, and usually she's holding it, when the question's asked, and this time she just opens the mic like, you dig it. I think a good way for a man to kind of navigate this would be, because every girl is different, and I think you have to be asking her
Use your words.
Like, do you like it when I do this, or do you like it when I do this?
100%.
And let her answer you, and then you're gonna have to figure it out. But yeah, I mean, like,
every person's different, so
It's more attractive to ask the questions and figure out what feels good for that person, and then have it feel good, rather than you get someone being male or female getting insecure about it and then like not wanting to do it again, or like, but that's a pattern I've heard of too.
I will say, related to that question is, know what your partner likes, but also know the level of aggressiveness, whether that's the right term, because biting can injure someone.
Oh, yeah. No.
I've seen things. I've seen injuries on the labia.
And that's also why a girl, like, he can ask you those questions, but if you're the one receiving, tell them what you want. You're going too fast. You're going too slow. You're going too hard.
Deep. Exactly.
They want to know what you want. So just tell them.
But to the partners that are doing oral, men or women doing oral on their partners, just know that area is highly sensitive. It has a ton of nerve endings. Has a ton of blood vessels. I mean, if you go crazy on women's anatomy, it's not going to be great and healthy.
No.
So anyway,
I'm having like
I feel like every girl has like a remembrance of a bad hookup where someone just was too aggressive. Like,
yeah,
we're all going there.
The kids call it finger banging.
I mean,
Spooky.
it can. I've seen. I mean,
spooky season has passed.
Yes.
And coming from a guy, communicate. Help us out. Tell us what's going on.
Yes.
We want to know. So communicate. Absolutely.
No, absolutely. You don't want to go in with blinders, right?
No.
And okay, so last question we got is probably for a urologist, but throw it out there. Are vasectomies really reversible?
Yes, that is not a question for a urologist. So a lot of my patients who don't want to use hormonal contraception, they're done with family planning. They have a long-term partner. They have vasectomies on their partners. Vasectomies are reversible in the sense because the part that is clipped at the vas deferens, which is the anatomy piece on the base, on the top of the scrotum, that area, the vas deferens is clipped. So we're not destroying, a urologist isn't destroying a large amount of the vas deferens tubes. They're just clipped, right? So if that clip is removed and the vas deferens can be brought together, it's reversible. But the easiest thing now is, when I tell couples, what exactly do you want for contraception? If you want permanency, that you should really consider vasectomy as permanent, because it is a surgical procedure on a man. Because
then I was going to ask, okay, well, if girls go on birth control and it's reversible, why don't guys get them the vasectomy?
Didn't you repost the story of someone that today, or who did?
I saw that.
Oh my God, that was so weird.
I saw that too. It said something like,
it was a t-shirt. It said, it was something.
Wait, what did it say? What did it say?
Hold on, I have to think. I think it was, if you don't believe in abortions, then get a vasectomy.
Oh yeah,
or something like that.
And it was him.
Whoa.
And it was him going like this.
Yeah, he was flicking the camera off. I remember I saw that as
that's a whole topic.
It was like, I know, but I saw it. I remembered it because I was like, holy, like taken aback.
I'm going to just put out the information on vasectomy is, I think men think that it's going to put them down and it's a major event surgically. It is not a major event surgically. It's a procedure that happens in the office. You get some numbing medicine on the scrotum. That little clip is on. The skin actually on the scrotum is skin glued. Like, there's no stitches. It's a really quick, and for women to have permanent sterilization, permanent removal of their tubes, that term permanent sterilization, it's a major surgical event. I have to put you to sleep under general anesthesia. I have to put laparoscopic cameras in. I have to fully remove your fallopian tubes. I mean, that is permanent, right?
Wow.
Because I'm taking both your fallopian tubes out. Whereas for men, it's like, and men think that the recovery is forever long, but it's basically achy. You have an achy scrotum for a day.
Wow.
Like we put you on a couch and give you an ice pack and then you're done.
Okay, but the colds for them are really tough too.
Apparently.
No, I'm kidding. Jackson just looked at me like with the worst face.
That's really funny.
I'm kidding, but I was, don't be sensy boy, Jackson. Oh my Lord. Are you kidding me? Well, I'm just saying, Jordan literally on the cold with a soup. I'm like, are you going to be okay?
When guys get sick in general, oh gosh, they're just down for the count for weeks.
Yeah. Yeah. I know.
We just struck a nerve, I think.
But that's why I think vasectomy should be upplayed. It is an option and it should be responsibility of the male partner to do it. So
I love.
Yeah.
Gosh, good questions from the listeners.
Yeah, those are great questions.
Yeah. Thanks for reading those.
I love when guys get involved in the questions.
I do too. Yeah. Do we want to talk about orgasm gap or do we want to go right into sexual confidence?
I feel like we touched on orgasm a little bit, but is there any more information we really need to share about the gap besides the fact that women don't orgasm as much as men?
I think I posted something too, which is pretty amazing. One thing I will say is there has been longitudinal studies on males with males, females with females, heterosexual partnerships. Do you remember that?
Yes, I do. I do.
Can you just go through that little swipe?
Yes, because it's good. It's good info.
Yeah. So the most important thing to note is the least sexually satisfied group of people were females with males in heterosexual partnership. Males with males, females with females. They had a very high level of sexual satisfaction because there is more of an understanding, I think, in maybe communication, and I don't know, or maybe more sharing of anatomical knowledge. But in heterosexual couples, I think it's all about penetration. It wasn't amazing. I literally came across and I was like, oh my God, I needed to go back to school.
That's like crazy. That's a revolution right there.
Yeah.
Like a revolutionary finding.
Yeah.
But it's the truth, I guess. And it's the finding from whatever study this was. But it just means more communication, maybe less penetration for majority. Yeah. I'm not saying all, because it is possible. But I think what I've heard is some men or women getting insecure because they can't make their partner orgasm by themselves and needing those toys. That's why I brought it up, because I've heard, people in different circles talk about that insecurity. And it's like, you can't be insecure about that. You need to use more communication, enjoy each other's company, enjoy the way people are aroused, and work together. It's not you're not turning me on. It's I get turned on in a different way with you.
That was the whole thing about that slide. I wish I could regenerate it.
I'm finding it right now.
But it was where in heterosexual partnership, it was truly pleasure for the man mostly than in the woman.
Mm-hmm.
Oh, okay.
It was a very bipolar.
The way they were having the sex, or maybe. Okay, I see.
Crap, I can't.
Are you finding it?
Yeah, I can't find it right now.
That's extremely interesting, though.
I'll share it with you again. I may have it in my slew of things, but
saying that though, I feel like communication is just urging women to communicate too. Like, you need to talk to the person and tell them what you need.
Right. And the thing is, oftentimes sex and satisfaction ends when the male orgasms, right? That's the achieving goal. And that's why I think that was very important to note, that's why satisfaction isn't happening in heterosexual couples, because the climax for sex is achieving orgasm for men. It's not for women.
Boom.
I don't like that.
So I mean, fair. That's unfortunately where we have been in these days, but I hope these days change, right?
Yeah,
this is the whole point of communicating this. Yeah.
I think a good way to do it too is because the finale is when the male, if this is a heterosexual relationship, when the male climaxes, I think that yes, you whip out the toys early and let her enjoy her time for a little bit as it's kind of a foreplay. You play with the toy, whatever. And then you get into the stuff for him, and then he climaxes, and now you both had a great time.
Teamwork makes the dream work.
And you also have to keep in mind that like you don't always have to orgasm when you have sex. Like I think a lot of times people think that you need to finish like for it to count as something, and a girl needs to finish. So then that's why they fake it, because they're like, oh, he's not gonna think like this was good sex if I didn't finish, and he's gonna be down on himself, whatever. And I think sometimes girls, you don't need to put that pressure on yourself either.
Yeah, I would agree.
Would you say that comes possibly from porn?
I think so. I mean, I think there's a lot of social norms and expectations. I mean, that comes from porn too, but
I know that there's a lot of bad things about, well, not bad. I shouldn't use the word bad. A lot of things that are not agreed upon with the Goop documentaries.
Oh, sure.
But I watched one that I was like, wow, one of the episodes.
Yeah.
And it was the breathing technique that they had women practice.
Oh, absolutely.
Because in pornography, historically, women are like moaning and breathing like little breaths. And she was talking about how that's not normal
not
whatsoever.
The norm.
And if you're not taking slow and relaxed breaths,
deep breaths,
you're not going to get to
I like that episode.
Climax.
Yeah, that was good.
That one I really stuck with me because I was like, what the heck?
Right.
Because being totally vulnerable, I've totally breathed like that because that's what we subconsciously, I think, thought was supposed to be it. When you talk with your friends or like, like when we were maybe a little bit younger, like more in college, I'm talking about.
Yeah. Yeah.
Well, that's just crazy to me.
Yeah.
Like I developed a habit because of how maybe a male and a female or whoever's, working on those films and pornography have displayed women.
Right.
That's just crazy. Like, I'm like, what?
Yeah.
It was the first, evolution in my brain. I'm like, oh my God.
Yeah. It's not the norm. It's not what women are doing. And I'll reference Love, Sex, and Goop because I do think some of the specialists, ultra specialists who are on that show, who are sex therapists and amazing people, by the way. I mean, just even light touch, not aggressive touch, but light touch on a thigh, on a body, on a part, anatomical part. I mean, that can, on an ear. I mean, the people have different zones. And that was very enlightening too in the show. Is like, you take a couple who completely has been asexual, a couple on that show, and then you put them into a moment of just, oh my God, this touch has turned them on.
Yep.
So
that episode was crazy. And how you don't have to go right for the vagina for like right away. Like it's about making everything, heat up like a little oven before we get right into it.
Like you don't have to go right for the penis. And
how much do you know about nipples?
Well, I see them all the time. And we do breast exams all the time. So some. No, just kidding.
Hey, how much do you know about nipples, huh? You got a quarter? I want to ask you a question.
My nipple hurts.
Okay, well, why don't you tell her why?
Is this a Candid moment?
Yeah.
Okay.
I got it pierced.
Oh, that's okay.
But I think it's infected.
Oh, no.
You need to see your doctor.
That's you.
Question.
So let's run to the bathroom after this.
You guys can go figure that out after. You'll be like, hey, Sarah, look at this. Right after the episode. Question. Because a lot of people think that once you get your nipples pierced, you cannot
or
breastfeed.
Have sensation or breastfeed. Yeah. No.
Sensation is better.
Yeah. So for nipple piercing, that's the whole point of it, is there's better sensation, but no, you can breastfeed.
Yeah,
I mean, you have to take the
I used to think you couldn't.
But no, you can't.
So that's why I only got one.
People thought that it would shoot out one of the holes on the side. I'm like, some of these things,
you're fine.
The assumption is I'm like, you guys.
Oh, I can't wait for my next breast exam with Sarah.
Yeah.
That's not how it works.
Oh my gosh.
Wait,
you can breastfeed.
Can I ask a quick question? Because I know it's a little off topic, but there were a few of the things that people were like, oh my God, thanks for asking.
You can't ask any questions.
You can sleep with the tampon in, right?
I would recommend not.
Okay.
And you can, and the days of toxic shock syndrome with the tampon, and this was back in the 70s, 80s, 90s, where there were probably really bad synthetic tampons being made. And that created a lot of extra moisture in women when they're having menstrual flow, which then created more bacteria, which then created bacteria in the bloodstream and sepsis and death. I mean, that doesn't happen at all, very rarely now with the tampons that are out. So I think if you don't have to wear a tampon at night and you're fine with a pad, great. I mean, just as long as you don't forget it.
Yeah.
Because here's a candid moment. I have to fish out tampons all the time.
Because you have sex. They have sex with them. I've done that before.
These guys won't ever want to know how bad it is. No one wants to know how bad it is when a tampon's left for weeks. Maybe
it is like something died is basically what people have told me.
I have to put.
No, I'm like, I want to make sure that
no, it is.
I'm like, people have told me.
No, and
I can. You think I forget something? I write everything down. I write down when I put my tampon
until
in.
You're drinking.
I have to actually shut down my room and keep it closed and put special air, tactics to keep it fresh when I take a tampon out. And taking it out is I have to actually take the tampon out, reverse my glove that I've had on, tie it up, put it into a hazards bag, and it still smells. So, I mean, I know that's scary, leaving a tampon in, but for women, I would just say keep track as much as you can.
Yeah.
Be mindful of it.
And also partners should know, and I'm always baffled by this, when you're having penetration and a tampon's there, someone must feel that.
Yes.
Oh.
So I'm often baffled as to why. And I don't know. Tampons get pushed up, they're absorbent, and I guess the strings are lost all the time, right?
Mm-hmm.
Tampons, the strings can break, but I think if you can keep track, and whether it's an app or whatever, reminder on your phone, we have this amazing phone that has 20 different alarms. I mean,
exactly.
Something.
You shouldn't. I feel like. How would you forget? Like, you go to the bathroom, you just switch it. I don't know.
I know people that have multiple.
It happens.
I've known people that have multiple up there.
If you're having, I've pulled out 2. I've never gone beyond 2. If I found out 3, I think my career would end today. I pulled out 2 max. If I ever saw 3 in there,
this is getting too spicy for me. This is an issue.
That just shows you how things can hide in there.
I'm going to retire at 3 tampons retained if I see that in my life.
God. Okay, wait. Another question, because people I've heard.
Speaking of tampons, though.
Okay, what?
Are there brands that you recommend versus? Because I have some girlfriends that are I'm not going to use your tampons. Those aren't like organic cotton made in the field in my backyard.
Well,
I just buy it an organic kind.
This is a good education piece for men and women, but to insert a tampon is not easy for women. And if it's not lubricated, if it's not plastic, or if it's not an easy transition, because you're not wet when you put on your tampon.
Sometimes I have to pretend I'm horny to put a tampon
or
on.
you put lubricant on the tampon. That's the trick I tell people.
The cardboard ones that are in the bathroom if you forgot one?
Yes.
Those things are literally
those are death. But they're environmentally friendly because they're cardboard. But for a lot of women who have trauma issues, smaller, the plastic coated ones are okay. Like get rid of your fear of the environment. It's okay to use plastic if that works for you, because
just use them
it's
for yourself.
Painful. And it takes one bad application of a tampon to never do a tampon again.
I have to take my time.
What about the actual cotton part?
The cotton part,
because that's the absorbent part.
I would say the cotton part, manufacturers will tout that it's environmentally friendly, that there's no dye, that it's got no chemicals, but it's so hard to study those. And I can tell you the whole female hygiene piece is a big money-making market. So you can market something as completely healthy, good for you, environmentally friendly. It's probably the same as every other tampon.
Yeah, I'm sorry, but organic tampons, what does that even mean?
That's what I wonder.
I fell for it.
That's what I wonder. So I'm just going to tell you, just use what's good for you. Don't use your friends. If you like a brand, stick with the brand. Don't convince your friend to use my brand. If it works for you, just stay with it. And if you're having a hard time inserting a tampon, also think you may have an anatomical problem, and see your doctor if you've had repeat attempts to try to insert. Because sometimes I have women where the hymen is not open. It is not open. It's imperforate, meaning it's not fully open. There's a septated or a division in their hymen, and they're trying to get this tampon through.
Oh,
okay. So just be aware. Wow, interesting.
Yeah.
Cleaning. I just want to call out that you said last time that all the summer's eve, is bad if you use those, but don't use those.
I was going to send you both a video. I could post it, but sometimes every time I see it, I go, gosh, that's a big vulva. But it's a woman. It's a woman in a vulva bodysuit. It's a woman.
Did you just say someone had a big vulva?
No, I'll get it. I have it saved.
Okay.
I have it saved. I'll send it to you.
Wearing a vulva bodysuit.
So it's amazing. She is one of the best educators on Instagram and OBGYN. I'll send it to you. It's great. She's got this big vulva bodysuit, and she tells you exactly how I would tell my patients how to clean their vulvas. Never to douche, never to put anything in the vagina.
No douching. Someone else that.
You don't need harsh soaps. You need to use a loofah. You don't need to scrub. What you need is running water, and you need to put gentle wiping between the labia minora and majora, because that does accumulate thick white, very normal, thick white, protective, sebaceous or oily discharge on the skin, because it's skin.
That's normal.
Yes, it's normal. I just am dying to show you this video.
We'll post it on Thursday.
Well, I didn't want to post it on mine because, It's
a little out there.
But
I'll post it for you.
I'll post it for you. And then we'll tag you, and then you can decide.
Any other thing that's out there that you don't know how to post, just send it our way.
Right.
Because we'll post it.
Right. This one's good though.
Speaking of hymen and tampons, sometimes it's painful. We had more than one person write in about painful sex.
Oh yeah.
I guess. What are some reasons for painful sex?
Gosh, I mean, that's a whole nother session.
Yeah,
I mean,
I know.
It really is. It's a lot of it is just not knowing what's right for you and what you like. A lot of it is stress, anxiety, anticipating the penetration. So many women are just dry and they're just not wet enough to receive, right? I could go on. Some is really truly pathologic, that they have spasm of the muscles around the vaginal opening that makes it extremely painful. Some have hypersensitive nerve system endings there that make it really painful. So, I mean, the best thing is to talk to a provider.
Yeah. If you don't use lube and you're having painful sex, I feel like that's the first step.
Yeah. Definitely. Position changes. I mean, seriously, that is a huge step.
Yeah.
Like if you're always, I love this. I have women who come in and they're like this, I'm always in the same position every time. And I'm like, okay, well, that's going to be
number one, boring.
That's going to be hard because the trauma, again, when women are on the bottom in missionary that's the most traumatic in the sense of how much force that they'll receive from their partner. To be very honest, if you cannot control the depth and penetration, that's where it's going to be most painful. And that is the position, right?
Interesting.
Missionary, the most common one.
Because you're not controlling.
So people say.
Right.
So maybe lube and try to, you go on top and you control for a little bit.
Yeah, being controlled is probably a safer area. Someone had written in asking about an IUD and if tooth parts. Should your boyfriend or significant other be able to feel the IUD, and do they need to be pulling out and being extra cautious?
Oh gosh, no. So once the IUD is in place, and I verified that the IUD is in place, which is a return visit to me in a month after I place it. And this is universal for most OBGYNs. So if you're not having a follow-up appointment a month after your IUD, you should say, I need an appointment to follow up. The month later that they follow up after I've inserted, I check the strings, and the strings are always cut to a standard length, so that one, as a provider, I can take your IUD out when you want it out.
Oh, that's
two, that I can check that your IUD strings are there, and that it's my way of knowing it hasn't moved or migrated. But the strings are kind of this very fine dental floss consistency, so a partner should never feel those strings. Sometimes if the strings are cut too short, then it gets stubbly.
Oh,
so if it gets stubbly, oh my God, your partner's going to feel it, right? Because it's not laying flat where it should be. So
that's when it's going to be
right.
You're
going to feel something.
Right. So the woman who has an IUD, she shouldn't feel a darn thing. That IUD with sex, she shouldn't feel.
He should, but he may if it's out of place.
He may, but
is it true that?
But here's what I tell patients. Sorry to interrupt.
No, you're right.
When I put an IUD, I tell patients, don't ever tell your partner that you have strings with your IUD,
because he's gonna think he feels it.
Right. So he's gonna make it up. Say we have great contraception. I have an IUD. You don't need to worry. The strings are for you and I. I say that to my patients all the time. The strings are for you and I to talk about, worry about, not worry about.
Don't need to think about it.
Is it true that you're supposed to have sex after you get an IUD in?
I mean, immediately. I mean, that's preference too, but no,
you're supposed to.
You can have sex.
Someone told, I had a friend that got an IUD, and she's like, yeah, she told me I should like have penetrative sex to like push it up.
No, that's a no.
Okay, so that's a myth.
Definitely means that it's not the right place, or maybe she misheard.
Right.
Maybe I misheard. I'm like, you better go have sex.
She's like, wait a minute, that's not actually what she said.
No, I swear. Wow.
There was another question about an IUD.
Okay.
IUD / birth control. And we touched on this. There's no long-term effects of birth control, correct?
There is I will say this again to everyone. There are no long-term effects of birth control.
Even if you've been on it for 20 years?
No long-term effects. It literally has not been proven to increase infertility. In fact, in some birth control pills, it may, once you're off, ramp up your fertility for several months because your ovaries are trying to ovulate. Once we take you off of birth control, they're like ready to go.
Oh.
But with IUDs, we've never prevented ovulation from the very beginning. So that hasn't, remember, fertility is ovulation. So
it's not possible. It's not doing that to your body.
No, it's
you don't
not
need to
creating
worry about
infertility. Never in contraception.
And this was the other part of it was, thank goodness for we have you here, Sarah. Seriously. How long do you need to go off birth control or take out your IUD before you can start, trying to conceive? Because that's a huge question for a lot of people. They're like, well, how long is it going to take?
So for IUDs, it's almost nearly immediate because remember, we haven't stopped ovulation. So if I pull out your IUD, you're going to be able to probably get pregnant within 1 to 3 months. The average time it takes a woman to get pregnant is 6 to 8. Once we get to 12 months on any form of contraception, that's infertility. So on birth control pills, the time it takes women to ovulate on their own is about 3 months. So 3 to 6, maybe up to 8. But most everyone achieves pregnancy by 8 to 9 months.
Okay. That's a good rough
on any contraception.
Yep. Okay. I just love reading all these because they're things that I've thought of too.
I know.
I'm like, oh my God.
I'm not kidding. We had pages, Sarah, and pages of questions.
Like it's almost like I'm sure.
Yeah.
Like people ask, like, does smoking marijuana impact fertility?
Well, smoking marijuana is equivalent to what happens with alcohol. It's a depressant. So whatever happened with alcohol is with marijuana. And when you add alcohol and marijuana together, just think of it doubling the effects of everything I just talked about. Right?
Yeah.
So people like their weed and they like their alcohol. So just be mindful of those effects.
When to be nervous about spotting?
At any point?
There we go.
I guess if it's consistent every single cycle and it's heavy every single cycle, middle cycle, come see me or come see a provider. But I think if it's occasional or you note it when you've just had sex, for example, that's pretty normal, right? Because when you have sex,
that's what I was going to ask too.
When you have sex, there can be fissures which are tiny tears in the skin, especially if sex has been repetitive and long, deep. So if you're hemorrhaging after sex, that is not normal. But I think spotting after or mid-cycle spotting when women ovulate, that can be common. But
or if you're switching birth controls, because that takes a while to regulate. I feel like I hate switching birth controls.
It's not fun, but
I've been wanting to try an IUD, but I'm so afraid to switch from the pill because one, I'm like, oh, the pill helps with my acne.
Right.
And I don't want to go through the whole the in-between of switching from the pill to IUD, get moody. So I've been so afraid, and I've been on the same birth control for probably 17 years.
Right. Yeah.
But do you think I should change if it works for me?
Never.
Yeah.
I wouldn't recommend that with you. No. Yeah. It's working for you. It's creating great skin. Don't do it.
Yeah.
Can I ask you a question? Because I've been on, how about this? A live little appointment for a second, because I have a question about myself.
Yeah.
So I'm 1 day away from getting my period or so.
We're
and
cycle
yes, if you're a guy,
twins.
you're thinking it 20s sinking. Why does it sink? I don't know, but
there's some of that. There's hormonal absorption. It's called pheromones.
You're absorbing my hormones?
No, you're absorbing my hormones.
Get the hell out of my hormones, bitch.
Wait, really?
Yeah, there's a pheromone phenomenon. There is. Yeah, where women can cycle together.
All of my high school friends were all linked up.
Yeah,
it's freaking weird.
Dorm mates. Yeah.
Wow.
From being around them, right?
Yeah. And that's if they're not on pills. Well, sometimes on pills, but.
Okay.
Well, so I'm 2 days away and I feel horrible. I feel terrible. I'm angry. I get emotional. I get sad. I think I don't have friends. It's all these weird, it's so dramatic, right?
Yeah.
But it's I feel like a bitch, a just total on edge, and I literally can't control it. And then I'll go to Jordan. I'll be like,
and it's every month too.
Every month. And he's he has to remind me what day is it? Are we close? Because I'll be like, why do you think it is that you want to break up with me? Do you think? And he's like, what?
Why did I say that?
He's like, I'm like, you implied it with the way you've been behaving. And he's like, you're the one sassing me right now. And I'm like, I'm done, I think. It's the most dramatic circle and every single month. And I don't know what is that.
And you don't even know it's your period until you think about it.
And then I'm like, it's really hormone fluxes can change women dramatically. And if you're on a pill and you're still having those big hormone fluxes, there are different pills to be on to make that better. So
is one worse than the other? Like IUD versus pills versus the little the one in your arm?
The Nexplanon. I don't know one implant. I don't know one is better than the other on creating. Anytime you can stop your period or minimize menstrual flow is great for people who swing with their periods, meaning that they have mood swings, right? So if Mirena makes your periods hardly there, taking your pills and skipping the placebo week and going continuous on your pills makes your periods disappear. So that makes...
I used to do that.
So maybe that's what I need to consider doing because it's not unhealthy. Like I was assuming, like I made up in my head or someone told me. Okay, so maybe that's what I do because it's terrible. It's like I'm this angry elf. Like, get out of here. Literally, I'm like, ugh. Can we transition into the piece about sexual confidence and sexual assault?
Yeah.
I think we should ask that.
I mean, we kind of talked about sex confidence, me and you.
Yeah.
No, totally.
And like, I mean, you're not a sex therapist, but you also know about this stuff because women will chat with you about it, I assume, but
more so maybe just one question around it. Maybe that's a good idea. So for somebody or people out there.
I'm looking at notes. Sorry.
Oh, no, you're okay. No, I love it. I love that you have notes too. People out there, because we talked about it earlier, like having a sexual assault situation, or maybe it was worse than that, like a rape situation. Like these are things and words that have to be normalized because they happen. I think that is a huge trauma piece why people decrease in sex drive and
pain during sex.
Like what advice, if like you have anything, would you suggest for someone who's gone through some trauma or some sexual assault that they're not feeling good about themselves?
It's really to try to talk it out and seek a therapist and to make sure you're communicating with your partner. That's the bottom line. It takes time and your partner needs to understand, but it also takes, letting go of that trauma because it is something that is with patients for a long time.
A long time. Yeah. Mm-hmm. Good to know. Yeah. No, I just thought it was really important.
It is important because we will have, I think we're having someone come on January in a couple weeks to talk about her experience with sexual assault and how, I mean, it does affect your sex life.
Oh my gosh. Yeah.
100%. And 100%. Some people it affects for the rest of their life if they don't, talk it through, have therapy. And I think you're right with being honest with your partner. And it's hard, I think, especially when someone isn't in a relationship and you're still like dating, you don't feel comfortable right away to maybe like, just like say outright,
I'm vulnerable. Here I am. Right? Yeah, exactly. Or like you're the first person I've hooked up with since something terrible happened. Please, be gentle or take it slow. I don't know how, whatever it might be.
Right.
Is there anything that you think we've missed in both these episodes that you want to touch on?
I mean, we could
a lot.
I mean, we could talk. I mean, like I said, we could talk a long time about the things that can pop up. And I'm happy, as I said to both of you, to come back and communicate more. What I just want to say is I love what you're doing with the community that's listening. I love that men and women are listening together. I think that the more education you get about each other, men knowing women, men knowing men. I mean, women knowing women. That's what is going to change the perceptions that we currently have today in our world about how we relate as people and what our relationships are like and what people's human bodies are, what our expectations of them are.
Right.
Mm-hmm.
So that's really all I would say. I mean, and like I said, and to have providers who get that, because I think if you're not understanding that really big piece as a provider, you're missing it. You're missing it. This is not the era that my 19-year-old daughter, who I'm sure is going to listen here and go, oh my God, that's my mom. She's talking again. But I'm sure she's going to be like, yeah, I wanted to know that. I should know that. And her friends want to know that.
These are the things that we should be able to know about our bodies, like men and women. It's just crazy that we don't, I think. It's
and which is
and
like, obviously this is an informational like podcast. And just so everyone knows here, like sometimes I'm diving in and saying some crazy things, but we want to make this fun too at the same time. So like, I appreciate you, even though you're my doctor, then I say some weird things about my sex life to you. Like it's all for the best.
If you can,
exactly.
But if you can't walk into an office and say, hey, I got this deal. Yeah. And I mean, I may go, okay, wait, I got to look that up and I got to familiarize myself with some terminology, but like you should say that.
Yeah.
Right.
Exactly.
Completely.
And we asked our straight candid listener advice questions kind of throughout this episode, I think, but you have one more, right?
I have one final one.
And then I actually have one that I thought of. So really? I have one more question. Yeah.
This is from a listener. So they say, I think some odor coming from your lady part down there is normal. Interesting how they can't say it, but how much odor is too much and that I should go in and get my vag checked out? I turned 21 in August and I haven't had my first pap yet. Should I schedule it sooner than planned?
So age 21 is the first time that you should have a pap smear with a provider, either family medicine, myself, or anyone who's doing women's health. Any odor that is fishy is particularly specific to something called bacterial vaginosis or BV. If something is real clumpy and white, that's typically yeast and that doesn't have an odor. But I think if you just feel like you're off, there are a lot of over-the-counter remedies or tests that you can do, but ultimately there are much more specific tests that a physician's office can do that are probably much more accurate. So just come and be seen.
Okay, I have a couple questions with that answer.
Yeah.
So I remember someone asking about BV.
Yeah.
I forget the exact question
I don't remember
they asked.
if I read it.
But what is BV exactly? How common is it? How do you treat it?
Bacterial vaginosis is pretty common. It happens when there's a big pH balance of the vagina. Again, episode 39, because the vagina is acidic.
Yeah. Oh,
and
yeah.
so trying to regulate that environment is what will best prevent BV. And so lots of products, too much showering, bathing.
Is it true?
I got it from
it's not an STD. BV is not an STD.
You got it from what?
I've had it from the what is it called? Summer's Eve wash.
Yeah, that's because it changed.
I used it.
Sorry,
and
it changed your pH balance.
And it was just basically I think I honestly drank cranberry juice and that was UTI.
Right.
These are all normal things.
Yeah.
But I was like,
what's the connection between I think I briefly saw this probably like a week ago, your gut health and your vaginal health?
Anything that you're consuming in your gut is usually generated from foods that have bacteria, and healthy bacteria propagate a healthy GI system, including the vagina. So I recommend probiotics all the time to patients for vaginal health and just GI health.
Lots of yogurt, sauerkraut, miso, and also a probiotic pill, right?
Yeah,
right?
all of it.
All of the above. All the above.
Okay, my question, because we talked about safe sex, obviously with STDs, wear a condom when it's a heterosexual couple. What do you do if, like, I don't even really know how exactly females have sex. I mean, I kind of can figure it out. If you're bumping vaginas, how do you have safe sex with a female to female?
Well, if they're using toys, which many of my patients do, you have to cover the toy if it's a new relationship.
Oh, cover the toy.
And use condoms like you would. Penetration still happens in couples, female couples. So I think just be able to realize that, if it's a new partnership, I still would be careful about exchange of fluids.
Okay.
That's the most important thing that's safe.
Because skin to skin is still
it's still safe,
susceptible
but very susceptible to sores, ulcers,
you can't
lesions,
put a
warts.
condom on a vagina.
Yeah, you can't.
Well, isn't there women condoms?
Well,
that's inside though.
Yeah,
it goes inside you.
There's a female condom.
Oh.
Yeah.
Okay.
Yeah, but it works very differently than a male condom. Yeah.
Wow.
I've always wondered that, because if a female has herpes,
she still is at risk of giving that to you if it's skin to skin, labia to labia, and rubbing. Yeah.
Oh.
Yep.
Okay.
Yeah.
Interesting.
Jeez. More you know.
Yeah.
More you know.
I'm like,
more you know.
Yeah, you guys are gonna have to have me back.
Like, are you kidding? We're like, every time you come on, we're like, okay, so then when's Sarah gonna come back again?
You know what? You know what we should do is we should we'll buy you a microphone, and we'll
to pipe in.
Well, what we'll do is, if someone writes in a question about something related that we need an OBGYN to answer, we'll be like, Sarah, we'll send you the little question, and you just hop on your computer and you're like, hey guys, it's Dr. Sarah. And then you could answer it and we could play it on the podcast.
Oh my God. Yeah.
Wouldn't that be fun?
We could have you send in like a tip or something that you learned, or like the knock of the day, AKA like
the craziest thing that happened. AKA
don't really matter as long as you can applicate it correctly.
She literally got here, by the way. She goes, just gave a big C-section.
I know. I'm like, God. And she's like a huge deal, everybody. Like a huge deal. I'll write down some of your, can you just kind of brag about yourself for just 2 seconds?
Yeah, brag about yourself, honey.
She's so cool.
Doctor of the year?
I mean, this will be the 6th time.
No,
this is
you thought I was kidding. I wasn't.
This is it. I mean, there'll be another running, but I've had that. I've been in that category for 6 years.
I will attest to that. It was I want to come back.
You're amazing.
But it's the Minneapolis magazine, the Minneapolis magazine.
Yeah.
They do the top doctors in the Twin Cities. And in the category of OBGYN, there's a lot of amazing colleagues that I have to tout for that have been there. And sometimes I think it is a marketing piece, but I've been there for 6. So
well, seriously, we appreciate you taking your time to come on and talk to the boys are bowing to talk to our age group, because we don't get this knowledge just every single day. And we have all these listeners that are like, Marcus was going to leave, but no, he stayed the whole time. He was like, this
Marcus
is good stuff. Good,
18 to 28 was the number that's our range of majority of our listeners.
Oh, I can tell you have people beyond that.
Because I know I do.
Because my patients are listening, and my patients are in all ranges, and I have some women in
that makes me so happy.
You guys,
and I hope that we're talking to them as much as we want to be, and I hope they send in more.
When I went into see Sarah at the clinic, I felt really cool.
Were you a celebrity?
Everyone was like, "That's the podcast."
And then you knew someone.
Yeah,
yes,
Sarah was taking me around.
Like,
hey guys, this is Candid. So,
oh my God, you're kidding.
No, I felt really. I think I texted you. I was like, that was so fun.
Oh no, you did. You did. You were like, I just like, someone recognized me.
Yeah.
You totally
I feel cool because Sarah comes to my workout classes on Thursdays, and I'm like, hey Sarah, and I'm like, you guys, Sarah's here.
I always see Sarah.
Cool. She's also badass in the gym.
Yeah,
badass. You guys. She kicks everybody's booty in the altar class.
I know you said this the first podcast, but how old are you again?
I just turned 49.
Yeah.
What in the hell?
I just turned 49 on December 2nd.
Give us your 49. Skincare routine later because we're going to need to know it.
Oh my God. It's just honestly, I mean, right? It's eating right, drinking more water than alcohol.
Are we sure about that?
And working out. Yeah. I mean, I'm like a fiend about it. Actually, today I didn't work out this is because I was like, I'm still screwed up from sleep and trying to catch up from travel. But today I didn't work out. And I was totally off. I'm like, I'm off my game.
I didn't today either. And
off
I feel
my game.
Off.
Yeah. So
it's
anyway.
hard.
Yep.
Well, okay. Thank you for being here. You're freaking amazing in every single way. We always refer to you as Dr. Sarah. We only call you Dr. Sarah because we just love that you're here.
Mane is really hard to pronounce.
Yeah, I was gonna say, I think it's because I don't know how to say your last name.
Yeah, literally. I'm like, Sarah M.
It's Sarah
where can they come find you,
so
listeners?
It's Oakdale OBGYN, and that's such a difficult concept because it's not Oakdale, Minnesota. It's actually, I have 3 locations. It's Plymouth, Blaine, and Maple Grove. I only deliver babies at Maple Grove. I'm with a huge group of really amazing doctors, nurse midwives, nurse practitioners. So yeah, come visit.
Wow.
Go see her.
Yeah. Come
and
visit.
what's your Instagram handle? You don't have to say it if you don't want.
Oh, it's SMANNEHDOC, I think.
We'll tag you.
That sounds right.
Millions of times.
Oh my gosh. I'll get that. This one's good. I got to get that.
Oh, yes.
Can't wait to see the body vulva lady.
Me either. I'm like, hell yeah.
Oh my God.
If you don't already follow us on Instagram at Straight Candid Podcast, please go check it out. Go check out our YouTube. Please subscribe. Thanks to the Back Pocket Boys.
Give us a review on Apple Podcasts, please. It takes like 30 seconds. It means a lot. It helps us get better guests on. It helps us continue doing what we're doing. So please, if you have the time today, please subscribe, rate, review, give us a follow at Candid Soph.
At Candid Sid.
And as always, we got Jordy in the house producing.
Jordy.
We got Adam also. What's your handles, boys? Because y'all asked some questions. And we got Marcus.
My Instagram is at Adam Stenny.
And at Jordy Dude.
I love it.
Oh, I'm at Marcus Sazin.
Yeah, Marcus.
Thanks,
all right, crew. We love you, Sarah. Thank you for being here.
Oh my gosh.
And I can't wait to have you back already.
Love
I'm already
you
excited.
Guys.
Yeah,
I know.
we love you.
I'm excited to be back when I'm back again.
Yes,
always,
back again.
Always a pleasure. And I love like having a smiling audience over here. It's really great.
I love that.
So
thanks guys.
Yeah.
Bye.
See you later. Bye.
What a good episode. That was amazing. Aren't you guys glad you came?
Oh, yeah.
You guys, did you like it? You loved it?
Gosh, I'm not missing this episode.